Our topic for this video is about drug excretion. A simple definition of excretion is the removal of drugs from the body. The different ways the body can excrete drugs out include urine, bile, sweat, saliva, breast milk, and expired air. The most important and effective way of excreting drugs out of the body is through the bean-shaped organs called the kidneys. This is where majority of drug excretion occurs. One kidney contains approximately 1 million nephrons. The nephron is the functional unit of the kidney. Now we're going to walk through the processes of urinary excretion, which is the result of these three processes. The first process that we are going to talk about is glomerular filtration. Here is our nephron again. The blood containing our small molecules of drugs travels through the afferent arteriole into the capillary network in the glomerulus, where there are small pores that allow fluids and small molecules such as our drugs to be filtered through the wall of the capillary into the tubular urine for further excretion. The holes in the glomerulus are very small, so large molecules like proteins cannot be filtered out and they continue out into the efferent arteriole like our blue. The next process we are going to talk about is passive tubular reabsorption. To help you understand this, here is a visual of the peritubular capillaries that follow the entire nephron. These capillaries are how reabsorption of drugs to the blood and secretion of drugs from the blood can occur in the nephron. Now we're going to show the nephron without the peritubular capillaries to give a better picture. The most important site for tubular reabsorption is at the distal tubule. Here is where drug concentrations in the blood are lower than the drug concentrations in the tubule. This concentration gradient allows a force to move drugs from the lumen of the tubule back into the blood. Lipid-soluble drugs can undergo passive reabsorption from the tubule back into the blood, like our green. Drugs that are non-lipid soluble, such as polar compounds and ions, must remain in the urine to be excreted out of the body, like our orange. Our final process is active tubular secretion. This is the transfer of drugs from the peritubular capillaries into the tubules and the collecting ducts of the kidneys. The tubules have a pump for organic acids and a pump for organic bases. The tubule cells also contain a P-glycoprotein, which can pump numerous types of drugs into the urine for excretion. This is where the active transport comes into play and the orange and blue switch places. So why should nurses know this? It's important for nurses to understand basic principles of excretion in order to maximize the beneficial effects and minimize the harmful effects of drugs. Having this knowledge will also allow the nurses to minimize medication errors. And here are our references. Thanks for watching.